If you asked Joe Average on the street, what's more prevalent, homicides or suicides? Most people would say homicides, even though they're small, whereas suicides are 48,000 people a year.
75 to 80% of people who die by suicide actually go right to their primary care offices before they die by suicide. Over 80% of people who die by suicide have a healthcare visit in the months and weeks leading up to their death, and over 90% of people have a healthcare visit in the months and weeks leading up to a suicide attempt. So people are right in front of us as healthcare providers in the days and weeks leading up to a suicide. And so we actually have an opportunity to do something about that.
Zero Suicide is an innovative approach to creating a safety net for patients who are contemplating suicide. The program links clinicians from all disciplines, resulting in a drastic reduction in suicide attempts and deaths. The Michigan Mental Health Innovation Network for Clinical Design, or MyMind, is a partnership of healthcare providers throughout Michigan to implement this strategy statewide, and it all starts with a quest for zero.
We believe that we have an opportunity to prevent every single suicide. In this program, we've implemented suicide risk screening, assessment, and treatment, evidence-based, into healthcare systems. Within our healthcare system, we saw a 70 to 80% reduction in our suicide rate. So even though we may never get to zero, the only acceptable goal is actually to strive for zero.
One thing I really like about the program is you reach out and engage the patient. And so they feel like they're part of their care. And again, that goes back to that action thing, it's part of care. And so now I have that responsibility to be part of it as well.
How MyMind will work in eliminating suicide is it's a two-prong approach. One is for the primary care doc to screen for suicide risk at every visit, and vis-a-vis a collaborative care model, which is an incredible partnership between behavioral health, primary care, and the patient to intervene, assess for suicide, introduce treatment, modify risk. The second prong is to teach all the behavioral health clinicians in the state of Michigan about zero suicide.
Obviously, for some people, it's kind of a stigma. Most patients are reluctant to go to behavioral health, or they may not realize they need to see someone in behavioral health, but they do trust their doctor, they do trust their provider, and they have a relationship with the provider. And I think that goes a long way in being able to share. They may go to their primary care doctor and say, I'm going through this. Sounds like you have some depression. May I suggest seeing someone who's really skilled in talking about these issues, can help work through these issues. And now we have a collaborative where we have a therapist, a psychiatric consultant, we have the primary care physician, all kind of working to serve the patient.
A key component to the success of MyMind is a unique partnership with Blue Cross Blue Shield of Michigan. Their support enables primary care, specialty care, and hospitals throughout the state to work in a collaborative environment, providing resources for data collection and analysis, along with administrative oversight. Through shared data, this partnership can help to implement best practices, improving patient care throughout the state.
MyMind actually is the first national initiative that's statewide that will partner with an insurance payer. All of the healthcare systems and provider organizations throughout the state are going to partner with us, along with Blue Cross, who's going to support and actually incentivize providers to do these processes in their care systems.
We want to improve quality of life, but we certainly want to preserve life. And MyMind is an opportunity for us to do so.
Our goal is not just to prevent suicide, it's actually to get people to be healthy and to live healthy and productive lives.
Maybe not everything is catastrophic, but when it is catastrophic or feeling it's going to be catastrophic, that there is help available. And so when we are in front of somebody, there might be a primary care physician that asks me these questions, that I am open and answer the questions correctly and honestly, and because that's where help is at.